All right. Good morning, everyone. Thank you for joining the October Brooklyn Duty Council meeting. Appreciate everyone being here. We have a great presentation coming up later today from Department of Health. We have Marsha Wong and Sering Dolker, hopefully I pronounced that right, doing a presentation on vaccinations, information, data, and things. I know a lot of questions have come out since the governor had talked about vaccinations and the impact it has to our field, getting it, everything involved. It won't just be only on COVID. They'll give lots of information regarding all the types of vaccinations available, and they will leave time for Q&A after their presentation. So we appreciate them being here. Appreciate Rihanna introducing us and getting this set up. Thank you, Rihanna. I saw you just popped on. Um, Quick updates from the council. So just keep on your radar. We are planning an in-person legislative event, legislative breakfast, like we used to do pre-COVID. We are hoping for the first week in February. We are trying to find a location. We may be going back to Brooklyn College like we do for our big fair. But nothing is set in stone yet. But right now we're just exploring, seeing where we can go, where it's going to best suit what we need to do for that day, because it is very different than our family support event in June. But it should be that first Friday in February. So please just mark that on your calendars as a hold for now, and we will let you know as everything is confirmed. Couple other quick updates. I know the chairs of the Meaningful Day Committee couldn't be here, but they wanted to make sure that you guys are aware their next meeting. The Meaningful Day Committee is coming up on Wednesday, November 19th at 4:30, and there's going to be a presentation by Parent to Parent of New York State on advocacy, and specifically with helping families and parents how to get involved in advocacy. So please attend that. We try to make that one later in the day for that committee, try to switch it up, see if it helps people attend, as opposed to all the morning meetings that take place throughout the month for everyone. That same day in the morning will be our Family Provider and Care Management Information Committee led by Debbie and Rose. And on November 13th, we have our Legislative Committee led by Maria and Lucina. The big focus of the Legislative Committee, please attend that. We're looking for more family involvement. We get agencies that show up. We would love families to show up. Just talking about what we can do in between the big events to stay in the faces of our legislators and continue to advocate for change and enhancements to our system. So they will focus on that, but also leading up to our big legislative event. Rochelle, anything you have on behalf of the council?
Nope, not right now.
Thank you. All right. Maria, anything from you specifically for the Legislative Committee? I saw you were on.
No, I think you probably said it all. Thanks,
All
Bob.
right. No problem. All right. So at this point, I will pass it over to Nina from OPW. Thank you for being here. And if you're ready, we can go ahead with the OPW update.
Yes, good morning. So I hope everyone is okay. And I'm going to start with federal updates, which is the most pressing national issue. It's the federal government shutdown. As you know, as of October 1st, the federal government is shut down because Congress did not pass a budget. This has a real consequences for New Yorkers. Over 116,000 federal employees are either furloughed or working without pay, including air traffic controllers and TSA staff. People may see delays in receiving Social Security benefits, veterans benefits, and other federal programs. SNAP and other benefits such as nutrition for women and children could run out of funds if the shutdown continues. Head Start programs, which support childcare for many families, are at risk, and hospitals are waiting for on federal reimbursement for the services they are delivering to patients, and families and seniors relying on housing support face uncertainty, and farmers also may lose access to federal emergency aid. There is no direct impact on OPWDD programs yet, but we'll continue to provide updates. October, moving to positive updates. October is a time for celebration, and this month we are marking National Disability Employment Awareness Month. This year is the 80th anniversary for National Disability Employment Awareness Month, with a theme celebrating value and talent. In New York, we also celebrate Disability Rights and Employment Awareness Month, which is, in short, DREAM, which was created by Governor Hochul in 2022. It's really a moment to recognize the value people with disabilities bringing to the workforce. The DREAM Symposium will be held October 28 and 29, actually tomorrow and Wednesday, at the Empire State Plaza Concourse in Albany, and the event will feature a job fair of 50. There will be more than 50 inclusive employees attending, a resource fair with agencies and providers, an assistive technology fair will be featuring demos from industry leaders, and we also released 2 short videos highlighting inclusive hiring and encouraging employees to sign the employability pledge, which was initiated by the governor's office. On the health front, and I think I mentioned last month that we are working on to close gaps in access for care for people with developmental disabilities, and Governor Hochul announced a $25 million grant to create regional disability health clinics. The application window is open until November 5th for the agencies who are already providing Article 16 clinic services. Also, agencies who provide Article 28 clinics and rural health centers and hospital extension clinics are eligible to apply for this funding. The focus for OPWDD will be to prioritize proposals that expand dental care, improve accessibility in sensory-friendly spaces, and bring specialty services to underserved areas. Moving on, with the strategic planning forums, OPWDD continued to listen and learn through our strategic planning forums that took place this summer. We have hosted in-person and virtual sessions across the state to update stakeholders on our 2023-2027 strategic plan. We heard directly from self-advocates, families, and CCOs, and commissioner conversations are continuing to make sure that family voices shape both our short and long-term planning. You probably aware that last week we had a CAS session in New York City, and that's because people have questions about CAS and why it matters. So CAS, it stands for Comprehensive Assessment System Tool, that one day will replace the DDP2 tool that is currently used, to kind of lay out the level of services and needs for the individual, for the individuals, and the DDP tool is currently used by agencies and CCOs, but we will be moving to the CAS tools. So CAS helps to ensure supports and services match each person's needs, and we were hosting a presentation and will continue throughout the October, hosting presentations for agencies, people, and families to explain the process. We have released an updated video on CAS, and a 5-part training series for care managers is also underway to improve consistency and quality in assessments. We also had a session with the providers And also OPWDD will provide training sessions to the provider clinical staff, so everyone has a better understanding and importance of CAS assessments. Unemployment, we're seeing great progress from our career-specific training programs. In 2023, OPWDD awarded $13 million for projects that prepare people with developmental disabilities for a job in hospitality, food service, office work, retail, and custodial services. As of March, and we're in October, but as of March of 2025, we had almost 450 people who completed classes and was 85% successful rate. And this program has been extended through March 2027 to expand training statewide and share successful curricula among the agencies. And finally, we made a major step in autonomy and rights for people with developmental disabilities, the adoption of supported decision-making regulations effective August 2025. New regulations implement Article 82 of Mental Hygiene Law. These rules help adults with disabilities make their own life choices with support from trusted individuals. The regulations explain how to create formal support decision-making agreements, set standards for facilitators, require training for providers and CCOs, and ensure agencies honor decisions made through supported decision-making groups. So, and that is all for me for today, but I also have Lucy, and Henry was supposed to join to speak quickly about local transition. Lucy, are you on? Or Henry?
I'm on, Nina. Pat is also on.
Okay, I'll turn it over to you then, guys. Thank you.
So good morning. So really, local transition is just a worldwide issue, and I don't want to speak in general terms unless there's specific areas that you guys want me to address. So I wouldn't just. I'm pretty sure everyone here present is aware of what the local transition coordinators do, how we interface with the local schools to help our individuals who are eligible for OPWDD services to continue receiving services. So unless there's a specific area that you want me to address, I wouldn't just speak generally about local school transition. Is there any issues or any areas in Brooklyn that you have noticed that we maybe can be of more assistance, or is there any issues or trends that you see that maybe we can address? Deborah, I see your hand raised.
Good
And maybe,
morning.
Deborah,
Good morning,
can
Henry.
I,
Good to
yeah.
see you again. You know,
Deborah,
one of the biggest issues is this. The District 75 students, they get much better transition services. But a lot of times children that are in what they call the community special education, they fall through the cracks. And the other issue is that they tell the parents and the students they can graduate at 18, yet they don't get they're not going to get what's the requirement, the Regents diploma, and many of them cannot even write well enough to do the Regents diploma. So those individuals, and I'm going to use the area where I live. When Christopher was in high school, they would send them at age 18 over to the YI day hab and say, oh, you can join there. And YI would get very upset, rightfully so, because that's not the way to do. So how are we going to get the non-District 75 special ed programs up to speed to understand that's not how you do it? And if the child is legally allowed to stay to age 21, but how do they start getting services from OPWDD? That's the biggest problem I'm telling you we have.
So, Deborah, so there's a current initiative that our deputy we started. I think it was last year, where we sent out all schools in New York City, all local schools. There's a current correspondence we send out to every school, not just to the District 75 schools, about our services and asking them to connect with us regarding those students. So that letter goes out to every school, and we do that every year. So other than connecting, sending those information to them and letting them know what we do and what we can, there's no other way we can reach everyone. So it's up to them to respond to that information, that correspondence that we send out every year, and so that we can connect with them and address issues which you just mentioned. So I'm pretty sure that every school gets get that letter that we send out yearly, to make that connection to all the schools, not just the District 75 schools.
Well, I just
Thank
hope
you.
that they, thank you.
And I appreciate you being here, Henry, because I know
Thank you.
one of the concerns we have on behalf of the council, and that I try to figure out, and it's definitely changed since COVID, is just getting representation from the schools at the meetings, at these events, hearing the information, being part of the conversations.
Correct.
And I don't know if you've noticed that change since COVID as well. There's been turnover in the transition coordinators in the schools. I see it's different in other boroughs. There's a lot more involvement than there is in Brooklyn for some reason. But I've reached out to some that still hold events, and there's only maybe one or two compared to what it used to be. But for whatever reason, there's just that disconnect between the councils and the committees and the families and the school representatives to be able to share the information that we have.
That's correct, and that's true, Brian. Paul, I see your hands up. You have
Hi, Henry. I
Yes.
actually think that is a little, I believe that OPWDD needs to be doing a little bit more than sending emails to the school about their services, because what happens is that Deborah is right. District 75 tends to do a little bit better in terms of a little bit better, just a little. I want to stress that, to transition the kids to services, because those are the children with the most needs. But we have a whole population of kids receiving services in the community schools in which OPWDD is a mystery to those families, and it shouldn't be. So I think that OPWDD needs to do a little bit of more efforts to be present and to push themselves into the schools to make aware of the services that you provide. It has to be a partnership. It's always this thing that, if you are served by schools, then, have OPWDD, we don't want to deal with that because until you're ready to transition. But in the only way that kids are going to transition properly, if you are there identifying the services, because it's a lot of confusion amongst families about what you provide and what school provides and where's the intersection of services. So I think that OPWD needs to do a little bit more.
Okay, before I ask Patricia to maybe add to it, just a correction. It is not emails. We have a list of all the schools in all regions of in all the 5 boroughs that New York City OPWDD oversees our region 4. So those letters go out, those correspondence goes out every year with packets with information about OPWDD, our local school transition coordinators, and what we do. So every school district has that information. So it's not just we don't send emails. So
Sorry, it's still not enough. You have to be present.
Well,
you have to do a little bit more. Once again, Henry, I don't want, this is not back and forth,
okay,
I'm sorry,
right.
but I'm telling you what I see in the community, because I get those calls, I get those families, and I think people who are here in this forum, that's what we are saying. So take it as, you are doing some, but more needs to be done. That's all I'm saying. Thank you.
Okay. So, Patricia, you have anything to add to that?
Good morning, all. I'm Patricia Webb. I am the local school transition coordinator, supervisor. I thank you for your input. Paola, did I say correctly, Paola? Thank you
Yes,
for your
yes.
input on, we are a limited resource as is, especially in Region 4. So all input is welcome. However, do you have some ideas as to how we would best maximize our limited resource to get it across to those schools that you mentioned that are underserved? We made the first volley trying to send out an email and an information blast, letting them know that we're here, this is what we provide, and this is what you need to be eligible and notable for OPWDD service. So in those schools, if they've identified individuals that may be appropriate for OPWDD, they should then have all information and input to connect. However, you said that we should do a little bit more. And if you have any ideas, we are welcome and open to all opportunities to reach out and to partner and to collaborate with the schools involved.
Connect directly with people who are dealing with the parents, parent coordinators, for example. Connect with them directly, tell them, call them, email those, because most of the time the person who gets the emails probably is the principal. The principal have 1,000 jobs. If you connect with the people who are working with the parents, like the parent coordinators, they have fairs, they have events, they have so many things that you can be present. And I don't know what limited resources mean, limited people. You only
Yes,
have
ma'am.
2 people for a whole department. I don't know what that means. Limited resources mean different things for different agencies, but whatever you have, I'm telling you, the person you need to connect and develop that relationship is the parent coordinator, because he or she is the person who is dealing with the parents who are in need, or at least parents that need to know about the services, because that's the worst thing, that parents call me, they have no idea that, about OPWDD, how to apply. So that's what I'm saying. Thank you.
I just want to say
Thank you
that
for that.
in New York City, we are working collaboratively with the New York City school system and state ed, and we are usually invited to the events with parents, with families, and we always have front door staff and our family support staff in those events sharing the information.
Thank you, Nina, for that input. I was just about to say that we are invited to events and we show up, we present, and we work one-on-one with families that show up to those events. So thank you for that input, Nina.
And I will say, to defend you guys, like I said to Henry before, there's been such a turnover in the Brooklyn schools that there's less outreach than ever in terms of when the events are, where they are, who they're contacting to come. Like, I have a great contact from one of the schools, and he'll always say, "Can you send me your contact list for the Brooklyn Council Fairs, so I know like who I should be inviting and who to go there?" But that's one person these days of all the Brooklyn schools that reaches out to us for support or for involvement. Where, like, again, before COVID, that every school in Brooklyn was reaching out, and it's just, we don't see that anymore. So I don't know what you can do to force people to get you involved, but I agree there needs to be more involvement, but it has to work both ways. Rochelle, you have your hand up?
Yeah, I am on a slightly different tack, although I agree completely with the issues that have been raised about a little bit more proactive involvement by your department, Henry, and the DDROs in the schools, particularly with the parents, because the level of lack of knowledge is staggering. And what happens is, these young people leave the school system and have nothing to do, nothing to do. But along those lines as well, I have a particular question about you. I know that you said, Nina, that you coordinate with state ed, which of course is important. But I'm also wondering, do you get any data or information from state ed about the needs of people who will be graduating in the next few years? Because I think we are all aware that, there's a growing intensity of support needs within our population. And for OPW to really prepare for that strategically, you would need to have that information coming from state ed to know how many, individuals with level 1 autism, level 3 autism, etc., or other, and other diagnoses or support needs will be coming out of the school system and in need of OPW supports. And that might help you target your intervention with the school system and plan strategically for what these students will need. Thank you.
Carrie, you have your hand up?
Thank you. I'm Carrie Banks from the Brooklyn Public Library's Inclusive Services Department. And Paula, I want to thank you so much for raising this issue. And I don't think it's all on OPWDD. I think the real problem is in the community schools where there's not as much awareness about the needs of their students with disabilities in the first place. I can't tell you how many phone calls I get from parents. Oh, my child is graduating in 3 months, but I don't think they can get a job. What should I do? Or my child graduated last year and they have autism and don't speak, or they have autism and and these are all from kids who went through the community inclusion in the community public schools, and that's how they know me, right? From the work that we do in the schools and stuff. So the idea about the parent coordinators is critical. Those are the ones who know the parents and the kids and their needs, and can do something about it. Anyway, there's so much else going on there too. But what I really wanted to say was the library is happy to help in any way that we can. If we can bring people together here at the library, if we can bring OPWDD together with parents in the community schools, we do work in our community schools. And I think part of the problem is that we're looking at it as a transition age issue. Transition starts in kindergarten, right? These kids we need to be looking at the skills that kids need in order to, even from the very, we all know this, right? From socialization to being able to interact comfortably with other age peers with and without disabilities, and being able to incorporate that. So, and respite care, things like that, the parents don't know that I met a woman yesterday who has 3 autistic kids and has not had an hour break in 10 years, like an hour, right? She's up most of the night with this kid or that kid. And she had never heard of OPWDD. These are and that was at our wonderful IncludeCon, by the way, but these are the families that are maybe getting the services they need through the schools, but are not getting the services that they need for life. So anything that the library can do to in person or virtually to host or whatever, even help you connect with parent coordinators where we know them. But the DOE actually does now keep an updated list of parent coordinators. So anyway, I just wanted to say that. And again, Paula, thank you for raising this really critical gap.
All right, we have 2 more hands I see up, and then we're going to move on because we do have a presentation coming up. Chris, you're on the phone.
Brian, sorry to cut in. He's having
you calling
Wi-Fi
me?
issues.
No,
Chris, are you there?
He's there.
Okay.
He was.
Chris, are you there?
Yeah, I'm here.
This,
Oh,
Do you want me
Chris,
I'll do it for you, Chris.
yeah, it's regarding Wi-Fi right now.
Okay. Brian, what Chris was trying to say, I asked him to do this with me. Thursday, November 6th, the FDR High School, which has a community specialist, is having a resource, a transition fair at night from 6 to 7:30 p.m. The person you need to connect to is Danielle Pomerantz, and I'm going to forward Brian the email because I can't get it on chat. Everything's going. I'm covering not just Chris, but 4 others. But if you need
all right,
to,
forward it to me and I can blast it out. That way, if OPW is not aware, they'll have the information.
Yeah,
I know
they
we
really
weren't
would love-
aware as a council.
right.
So I can make sure we all get it. Thank you, Debbie.
You're welcome. That's what he was. And I will read his reports after the other,
Yes.
but this is something I asked him to do, but he's having connection with
No
Brian.
problem. Thank you,
All
Debbie.
right. Thank you,
Thank
Brian.
you, Chris.
He's sending in
And
2
then-
minutes, the most.
Okay. And then the last question,
You're welcome.
Pilar.
You're welcome, Brian. This
Thank
is
you.
just Chris saying you're welcome, and Debbie will do my calendar.
Yes, thank you, Chris. All right, go ahead, Pilar.
I just wanted to add that this is, something that we've obviously had issues with in this general committee, but like, obviously within our work. Outreach is a really challenging thing. I'm, doing much more outreach in my current role with the HRC. And so it does overlap into the committee work. What I think that we need to continue doing as a council, as well as a community, is engaging with local government. Number one, we need to make sure that they understand that this is a large population of their constituency, not just the mayor, not just, the council people, but the local community boards can be very helpful. They do post their flyers in their offices. Sometimes some, again, are better than others, and it really depends. What I found is some only want to share about their particular neighborhood and maybe not the larger Brooklyn neighborhoods. So these are things that we can do also as agencies and as a committee to make sure that they understand, like, in their constituencies are people with disabilities, and they're often getting calls about resources and information. So setting up offices or setting up maybe some type of joint resource within these offices might be a good idea and a good plan. And it's something I'm trying to explore. And secondly, DOE, obviously we know they have their constraints and their issues that they're working with, overlapping, but I'm hoping that, maybe we can try with the new incoming chancellor, whenever that comes, to reach out. But they have people that are designated an entire District 75, like just transition lead. And at one point, I think some of us had good contact with them, and that has definitely fallen off in the last year or so, to make sure that they are not only just inviting us to their resource fairs, right? But it's an all year round resource and connection for the D75 team and their transition coordinator lead. Whoever is that appointed person should be at these meetings, at the general council meetings, in addition to any of the other committee meetings. And that's a problem because that's how the messages trickle down. At every school, it might be a transition coordinator, a parent coordinator, a social worker. We don't know who the contact is for every school. And I have an ongoing list, which is very challenging, because it changes every year. But the lead person, whoever is identified at DOE, if we as a committee could get that person and whoever's on their team committed to participating in these conversations, I think the trickle down would be much better, instead of, like Carrie was saying, only at the times of high school transition. There are other times to have these conversations that are very important. And it would help the schools and teachers and educators be more informed about OPWDD and not just the Department of Education side of services.
Thanks, Pilar. All right, last one, Ellen, and then we will move on.
It's disheartening to hear this same conversation again and again, right, Debbie? We don't hear, we don't know, we can't see, we don't say. The reality is that transition doesn't start at kindergarten. I'll disagree with you on that. But the legal start is at age 14, and people are not, there's not a lot of communication between the junior high school age folks and the high school age folks, because if you started at 14, that means you have to have planned it at 12 and 13 when the kids were in junior high school. I think if there was a chance to better communicate or urge the DOE to create a better communication channel, that would be terrific. The other end, I do agree with Carrie about how many people do call and say, I can't, I don't, I haven't. You mean we're supposed to do that? The lack of information is incredible. But at the same time, maybe we have an obligation, because a lot of times people look at the OPWDD councils and say, oh, they're only for older folks. They're not for my kid who's in the second grade. They're not for my kid who's just been diagnosed with DD. We don't go to them. We don't see them. We only see them as dealing with older folks. I'm not looking to hurt anybody's feelings. I'm just saying that the perception publicly is that the councils only deal with older folks. And last but not least, maybe, and it's a big ask. Maybe it would be worth it to ourselves go into the schools once a month, or have a table once a month at the school, or have a contact at any school that we're familiar with, just to keep them apprised of what we're doing and to ask them what they're doing. I think the people at the DOE have a lot to do, and they
Oh, yeah.
don't get a whole lot of respect. So we have an obligation too. It's not just to generalize them.
All right, I'm gonna give a few minutes if Henry, Patricia, Nina, if any of you want to just respond, make some final remarks. But we definitely appreciate you being here and welcome you back to any of our future meetings. Love your input and just hearing some of the concerns that we experience.
Yeah, I see that Lucy, she has audio issues, but she left some comments. But we're gonna take, I'm gonna take this issue and concerns that were expressed today, and I'm gonna discuss that with James Doherty. He's our director, and we have a new, actually, we have a new deputy who will be overseeing waiver and local transition unit. It's Contessa officer. And Michelle is currently overseeing that function. So um, I brought Henry today because, in the last meeting, you brought up the concerns, right? And we will continue that conversation. All right, thank you.
And I just want to add that, the feedback again, the comments you made today are all well received, and it's a working process. And in future initiatives, as they come by, we'll take this into consideration and see how we can even reach out even more. But I'm glad that you're at least realistic about the issue, knowing that it's both ways, that also we need to be involved and schools need to be involved and everyone needs to be involved. And as soon as, if we're invited, we'll surely be there to do our best to, play our part. And thank you all.
I agree fully with what Henry just said, as well as a number of you have highlighted that you keep getting contacted. Please, once the family has contacted you, please feel free to share our information with them that you have, or to at least direct them to our main number so that they can, begin to link with OPWDD. Appreciate all of the feedback. Thanks.
Thank you guys. And again, we appreciate you guys being here and listening and supporting and giving feedback to us as well. Ruth, I see your hand up, but we do have a presentation waiting. Can I come back to you after? Because we're gonna go to our presentation from New York City Department of Health. Then we're gonna get the update from Kate from IAC, and then we'll get into our normal announcements and let people come on. But again, appreciate everyone being here, and especially all of our representatives from OPW and contributing to the conversation. So now I'm going to introduce and pass it over to Marsha Wong and Sarang Dolkar from New York City Department of Health, and they're going to do a presentation for us on vaccinations that I had reached out a couple months ago when Governor Hochul came out with some of the changes in New York involving vaccinations. So
Thanks.
Marsha and Sarang, you guys ready?
Yeah. Just wanted to confirm, how much time do we have for this? Just double checking.
I know you guys had asked for a half hour. That should be okay.
Should still be okay. Okay, great.
Yeah.
All right, I'm gonna go and share my screen and Sarang.
Sure.
Go ahead.
Hi, can everyone hear me?
Yes.
Okay, great. Thank you, Brian. Good morning, everyone. My name is Sarang Dolkar. I'm a congregate setting disease investigator with the New York City Health Department Bureau of Communicable Diseases. I work specifically with OPWDD agencies throughout New York City to provide guidance on respiratory viruses and also other gastrointestinal illness. Today, I was invited to talk about respiratory virus season to provide some updates about the 3 respiratory viruses we track most closely, which are COVID-19, flu, and RSV, and also talk about ways you can protect yourself and your loved ones. Also, I just want to remind that at the end of the presentation, we will be taking questions, so you will have time to ask any questions later.
Great. Thanks, Sarah. Does this presentation look okay?
Yes, it looks fine.
Okay, great.
Thank you, Marcia. So what are respiratory viruses? Respiratory viruses such as COVID-19, flu, and respiratory syncytial virus, or RSV, are each caused by different viruses. They spread mainly by droplets produced when someone is sick, coughs, sneezes, or talks, as you can see in the picture. People can become sick if infected droplets or infected mucus or saliva enter their eyes, nose, or mouth. So while people may be more familiar with the flu and COVID, respiratory syncytial virus, or RSV, is another common respiratory virus that can be serious in infants and older adults. RSV has new vaccines and medicines that help prevent illness in older people and in infants and young children. So there are certain populations that are at increased risk for severe disease from respiratory infections, including but not limited to older adults, young children, pregnant people, Black, Indigenous, and people of color, and residents of long-term care facilities. So health conditions that put people at higher risk of severe disease include, but are not limited to, those with weakened immune systems, having a disability, diabetes, and other chronic illnesses. Also, young children and older adults are more likely to be hospitalized with respiratory viruses. Infants and young children aged 0 to 4 are 11 times more likely to be hospitalized compared to older children aged 5 to 17 years old. Also, with adults aged 65 and older are 9 times more likely to be hospitalized compared to younger adults 18 to 64 years old. So this is why we really prioritize these populations for vaccines. So what is long COVID? Long COVID includes wide range of new, returning, or ongoing health issues that occurs after COVID-19 infection and are present for at least 3 months. And as you can see, some of the common symptoms are similar to feeling tired, cough, feeling short of breath, brain fog, sleep issues, mood, or memory changes. So there's no specific test for long COVID. You should talk to your healthcare provider if you have symptoms after a COVID-19 infection. There are no specific treatments for long COVID. Treatment usually focuses on managing symptoms and improving daily function and quality of life. The best way to prevent long COVID is to avoid getting COVID-19. Getting an updated COVID-19 vaccine is really one of the best ways to protect yourself. So first, we will go over some graphs of these viruses over time in New York City. So here, this graph shows a positive lab report for COVID-19. The horizontal axis you see is the time starting in September and running an entire year. And the vertical axis is the number of cases of COVID-19 reported by laboratories in New York City. So this does not include home test kits, and each color in this graph represents a different year. For the current year is in red, which is just beginning, and the past 2 years. Currently, COVID cases are slightly lower than at this time last year, which you can see the dark blue line. You can also see reported cases have shown a bump recently, but they're decreased from the previous week. And the arrow here represents where we are now. So while RSV and flu levels are generally high once a year during the fall and winter season, COVID has so far had 2 peaks a year, once in the winter and once in the summer. Here, similarly, this graph shows a positive lab report for flu. Currently, flu cases are low and have not changed compared to the previous week. And the arrow here represents where we are now. And it's expected to go up as we head into the winter season. And finally, this graph shows positive lab reports for RSV. Currently, RSV cases are low and have not changed compared to the previous week. The arrow represents where we are now. Now we're going to talk about vaccines, which are really the best tools we have to prevent infections, hospitalizations, and deaths from respiratory viruses. So these are the New York City COVID vaccine recommendations for this year. So these are the New York City, New York State COVID vaccine recommendations. I know there's been a lot of confusion, but the bottom line is that everyone 6 months and older should get an updated COVID-19 vaccine. And the vaccine is especially important for children aged 6 to 23 months, adults 65 and older, those at increased risk or living with someone at increased risks for severe COVID, also those with increased risk of exposure to COVID, such as healthcare workers and people living or working in a care facility or other congregate settings like OPWDD group homes. Sorry, just give me 1 second. Can you hear me?
Yeah, you're good.
Okay, sorry, I lost connection on my side. So I'm just trying to make sure I have the right slide on my screen. Sorry about that, just give me 1 second.
Let me know which slide you wanted to.
Okay, the underlying conditions that increase the risk of severe COVID-19.
That one. Okay.
Okay, sorry. So the reason we included this slide is to illustrate that most adults are included somewhere in the list of underlying conditions, including being pregnant or recently having given birth or thinking about becoming pregnant. We have here anyone with the mood disorder, including depression, anyone who is technically considered overweight, anyone who is a current or former smoker, and anyone who's not physically active, which we know is very common. And I certainly fall in that category as well. So what are the benefits of the flu vaccines? Pivoting to the flu vaccine is the best way to protect yourself from getting sick from the flu. And if you do get the flu, it protects you from being severely ill, hospitalized, or dying from the flu. It is recommended for everyone 6 months and older, but it's especially important for children under 5, people 65 and older, and pregnant people. In pregnant people, it not only protects during and after pregnancy, but it also protects newborns in those first few months of life when they are most vulnerable to infections. And the next slide, so nationwide during the 2023-2024 flu season, the flu vaccine prevented flu illnesses. About 1 million more people that live in New York City, 5 million medical visits, which is the population of Queens and Brooklyn combined, and 2 Yankee Stadium worth of hospitalizations and 8,000 deaths, which is just about the number of people to fill Radio City Music Hall. So imagine the impact if more people got the flu vaccine, and this is why we continue to emphasize the importance of getting the flu vaccine. Next slide. Everyone 6 months and older should get the annual flu vaccine, and most people 6 months and older should receive an updated COVID vaccine. For COVID-19, Pfizer and Moderna and Novavax are available. Novavax is for those 12 years and older, and some people do like this vaccine because it uses the older non-mRNA vaccine technology and may have fewer side effects compared to Pfizer and Moderna. So these vaccines protect against the currently circulating COVID-19 variant and flu strains, which change every year. So ideally, people should get the vaccine in the fall. And people should still get these vaccines even if they had these vaccines before or have had COVID or flu before. There are several RSV vaccine options for older adults, currently recommended as a single dose for everyone 75 years old and above. For people 50 to 74, those who have certain chronic medical conditions or live in a long-term care facility should also receive a dose. As with the vaccine, during pregnancy, if you have already been vaccinated, you don't need to get vaccinated again at this time. All these vaccines are safe and effective. COVID and flu vaccines are life-saving and strongly and widely recommended. RSV vaccines are recommended for some, so ask your healthcare provider if this might include you. You can find a vaccine near you at the New York City Health Map or check with your provider or pharmacy. COVID vaccines will remain free for most people through their health insurance. And next slide. And now we are going to talk through some commonly asked questions about vaccines because they are the best tools we have to prevent infections, hospitalizations, and deaths from respiratory viruses. Now I wanted to go over some common questions regarding the updated vaccine. So why get the updated COVID and flu vaccine if you've already gotten previous vaccines? I'm sure most of you have this question in mind. Both these viruses do change over time, so we expect that we will have to continue tailoring the vaccine to whatever is going around right now. Also, over time, the immune system can lose its memory of prior vaccinations or infections. So the updated vaccine is more specific to the current variants or strains. So it boosts the immune system to recognize what is going around right now and fight the current viruses more efficiently. If you have already received the RSV vaccine, no updated dose is recommended at this time since the RSV vaccine is not an annual vaccine at this time. Next slide. So why should you should get vaccinated even if you get sick with the respiratory virus anyway? Like all vaccines, everyone receives. Nothing is 100% effective at preventing infection. However, as we saw a few slides back with flu, the updated vaccine works to decrease the risk of hospitalization or death, decreases the severity of symptoms and duration, and for COVID-19 decreases the risk of long COVID. So can you imagine if we didn't have a flu vaccine and all of Brooklyn and Queens were hospitalized? That would be a lot of people and would overwhelm our hospital system. So you cannot get COVID-19 flu or RSV from the vaccine. These vaccines are produced using components that are different from the actual virus. Some people have mild side effects from the vaccine, but this is not the same as getting sick from the virus. Severe reactions to the vaccine are very rare. So if you get sick shortly after getting vaccinated, it might be another virus. Many other respiratory viruses are circulating year-round. So, it might be the side effect of the vaccine, or it might be another virus. It also takes 2 weeks for your body to respond to the vaccine to start protecting you from the virus. So you may not be protected during this time. I also want to remind people that for COVID vaccines, if side effects are a concern, Novavax has fewer side effects than the other two mRNA options, and that's as expected due to the way it builds protection in your body. And finally, this isn't a virus, but a bacteria that can cause respiratory infections. People 50 or older should receive at least one pneumococcal vaccine. And we encourage people to get their vaccines at the same time. It is safe. And then you are protected against multiple illnesses. Now let's talk about treatments for you, to get these viruses. There are treatments available for COVID-19 and flu. So why should people get treated? Both COVID and flu have treatments that work similarly by lowering the amount of virus in your body. It also reduces symptoms and prevents hospitalization. They work best the sooner you take them, so get tested for both COVID and flu right away if you have symptoms. And just as a reminder, treatment is not a substitute for vaccination, which remains our best tool against COVID and flu. So who can get COVID treatment? People who have a diagnosis of COVID with symptoms and are increased risk of severe COVID are eligible for treatment. Treatment consists of pills, which must be started within 5 days of when symptoms begin to be effective. The earlier they are started, the more effective they are at preventing people from becoming sicker. And who can get treated for flu? People who are younger than 2 or over 65 years old, pregnant people, or people with certain health conditions should get treated if they have the flu. It must be started within 2 days from when symptoms begin. And there isn't a specific antiviral treatment for RSV, and most cases will resolve without treatment, but people can take over-the-counter medications to help with symptoms and should drink plenty of fluids. Also, call your healthcare provider to get treatment for COVID or flu. And if you don't have a provider, you can also visit expresscare.nyc or can call this number 631-EXP-CARE, which is 631-397-2273. And COVID and flu treatments can decrease symptoms and help prevent hospitalization, but timing is the key, so start early. This remains a critical tool for people at risk for severe disease. And if you don't have a regular healthcare provider, visit expresscare.nyc. Remember, we have many additional tools to prevent the spread of respiratory viruses. Our core strategies to prevent the spread of respiratory viruses include vaccines, treatment if you become infected, good ventilation or air exchange indoors, washing your hands regularly and cleaning surfaces frequently, and staying home if you are sick. Additional strategies include physical distancing from others, wearing masks, and testing. You might decide to use these additional strategies when there is a lot of illness around, such as during the winter. And if you know you've been exposed to a virus or not feeling well, or if either you and others around you are at higher risk of severe illness, the main message here is that all of these strategies work best when more than one is used at the same time. So when you are sick, we recommend that you stay home for at least 24 hours from when your symptoms are improving and you haven't had a fever. Then you can resume usual activities, but just taking extra precautions for the next 5 days after that. such as increasing your hand washing, cleaning surfaces more frequently, improving indoor air exchange, masking, and distancing from others. So in summary, just being up to date with vaccines remains our best tool to prevent severe illnesses, hospitalizations, and death. Everyone 6 months and older should get an annual flu vaccine, and most should get an updated COVID vaccine. Older adults and pregnant people and young children should also get an RSV vaccine if they haven't received it before. Using prevention strategies like this in combination is the best way to protect from respiratory virus infections. And these are some of the resources. You can find more information on vaccine or what to do when you're sick with COVID-19 and long COVID. And and thank you so much for your time, and we are ready to take any questions.
Thank you so much for doing that for us.
And I'll go ahead and put the
Good.
links in the chat while we're at it.
Great, thank you. So if anyone has any questions, please use the raise hand feature. Ruth, do you have a question or is your hand still up from before? No questions. There we go. Rochelle.
Yeah, you knew I'd come up with something. Oh, no, my concern actually, I want to thank you for the presentation. It was extremely comprehensive and I think answered every potential question about, these diseases and treatments. My concern is, do we see any impact of the new federal policies on the availability of vaccines here in Brooklyn and the rest of the city?
Sorry, I'm just trying to come off mute. Hi, I'm Dr. Wong. I'm also from the health department. So I think the good news is that because I know there was so much confusion and it was a bit of I have to admit, a bit of a wild ride with the federal government in the last, I don't know, since January, but in terms of vaccines, really since I think the summer when we weren't really sure what was going to come down. And I think basically what happened was we are really relying now on New York State guidance. So we're actually not really following federal guidance anymore, and other states are doing this. So if you've heard of like the West Coast collaborative. We also have a Northeast collaborative that is really trying to sort of consolidate sort of like best practices as well, sort of based on the best scientific evidence to really come up with these recommendations. And so New York State really has released, a number of, I think they're like, I guess they're executive orders, I believe, from Hochul, from Governor Hochul, and that really has made the vaccines accessible. And so really, like we said, 6 months and above really should be getting any of, particularly for flu and COVID. So we don't anticipate that there will be any changes from last year in terms of accessibility. People should just be able to go to any pharmacy to get a vaccine. I will mention for pharmacies, pharmacies can administer vaccines, I think 3 years old and above, and then people under 3 will probably have to get it from their pediatrician's office. I know I think like pretty much all the health insurances are covering it as well, including Medicaid and Medicare. And so I don't think there's been any issues with insurance coverage. And as far as I've known, I have not heard stories of issues of people, that may have happened sort of early on in the fall, but I think at this point, there have not, as far as I know, there's not been issues of people accessing the vaccine. I was able to get mine. My kids were able to get theirs, both COVID and flu, and there weren't any issues with either of those. So I think we're good. Please do let us know if you're coming up with issues and we can try to help. But I think I think it's been okay so far.
Thank you. Debbie?
The question I have is, I have 1 or 2 family members who are allergic to certain ingredients in many of those vaccines, and they really can't take it. They were tested carefully, and the reactions were bad. So what do you suggest for them?
That would be something they would need to work out with their individual healthcare provider because I don't know what what's been.
Well, with the flu, if they're allergic to eggs, they can't do it. And if you want to do the shingles, the shingles has pork in there. And there are people who are allergic to the protein of pork. And we have constantly I know my physician and of other family members, physicians have asked the New York City Department of Health as well as New York State Department of Health, what else can be done, give them guidance. So that's what I'm asking. So that's why I'm bringing this to your attention,
Yeah, I
because it's
would.
scary when you're allergic to certain things and you
Yeah,
can't do it.
we used to say I'll address. I'm not going to be able to address the shingles vaccine.
Fine. But
Time
the flu is serious.
for the
One family member took it and we did it at a hospital and they had to get close. They had to have an epinephrine shot. It was bad. They don't
yeah,
want to go through that again.
should be managed by probably an allergist. And again, I can't really comment on sort of individual people, but I will say we used to say that, um, there was a new recommendation as of, I think, last year or maybe even 2 years ago, where people who are allergic to eggs can still get the flu vaccine. That has really been, and there really hasn't been issues with sort of cross allergies with the flu vaccine and eggs, like there used to be in the past. So I guess I will say that for flu. Um, but again, I think if people are super allergic to it, then again, that would be something that they would have to really discuss their personal situation with their individual doctor and potentially, uh, in collaboration with an allergist. I think for the respiratory viruses, even if you cannot get the vaccine, there again, we went over sort of the other measures to try to prevent getting sick. So I think one of the key things is actually just masking when you're in crowded situations. That does work to, I mean, nothing's 100%, but that does work to help people protect people from getting respiratory illnesses. Sorry, it's really
The
loud.
mask would be nice if like other people who would wear their masks correctly. I mean, they see them coughing and sneezing and the mask is down below their nose. And I'm like, what good is that then?
Yeah. I mean, you
But
can address the person directly if you would like to do that. Again, I can't control how people wear their
no, no,
masks.
no, I understand. No. But I'm just saying it does frustrate people who have compromised immune system. But I just I hope they've updated what to do for people with allergies to these vaccines.
The allergies are actually incredibly rare. So sort of from a public health perspective, we don't address,
They're
they're very,
they're more prevalent than you realize
they're
because
also,
after a while, certain family members who are also in the OPW and OMH world refuse after a while to talk about it because they're tired of being yelled at, screamed at, and it's scary. So I just want you to be aware that everybody's not telling you why they're not doing things. It's more prevalent than you realize. Seriously.
like I think someone said, people do really need to talk to their own doctors. Again, I can't address like each individual situation. And I think that has to be like a decision and discussion with their personal doctors. Because again,
Yeah. They'll say no, won't do it.
and that's
Okay.
up to not forcing anybody to do what they
No,
don't.
I didn't say that, but just so you know, you won't, that's why you don't have enough data on the allergies. Seriously. But
Okay.
thank you anyway.
Are there other
Eh,
questions? Sorry, I'm also
So
looking
again,
for.
this was recorded. This will be posted. So if anyone does have questions, you can either get it to me and I'll pass it along to Marsha and Saring, or I don't remember if your contact information was on that presentation, but either way, we'll get the information over, the questions over, so we can
I'll
certainly share it and get responses.
Yeah, I'll also put in our email. We support OPWD group homes with our sort of congregate setting work. And so I know something that has been mentioned to us, so I'm putting the email in the chat. If you are like a group home, or if you have group homes in your portfolio, feel free to reach out. I know sometimes it can be difficult to get people to a vaccine site, for example, and we may be able to help connect with pharmacies that are able to do on-site vaccination. So we still do offer that in terms of just helping to facilitate to see if there's a pharmacy near you that can come on site and get everybody vaccinated on the same day. So that is something we could potentially help with. Again, we do this with group, not like family, like individual families, but in a group home setting, like the IRAs or the ICFs.
When you set that up, is that just for the people that live there, or is that for their staff as well?
It can be also for their staff. Yeah, as long as you're like present the day that the pharmacy comes.
Yeah.
Yeah.
But then they can have a big group come, so it's not just the residents, it's also however many of their employees they could have show up.
Yeah. And yeah, I think that's all. Or if there's other questions about like other infectious diseases that can spread from person to person, we're also happy to support that as well. Okay, so I'll stop there and I'll go ahead and work on getting the rest of the links in the chat. I think I put the New York City health map on there. So that's where you can go and just enter your zip code and can find a vaccine, at a pharmacy or somewhere close to you. Thanks for having us. Really appreciate your time.
We appreciate you being here. Thank you, Saring. Thank you, Marsha. Thank you for Rihanna for connecting us. We appreciate it. All right. So now I will circle back. I believe we have Kate with us. Thank you for being patient with us, Kate.
Can you hear me?
Yes, we can.
Yeah. Hi, I'm sorry. Thank you everyone for being patient with me. Just had a meeting earlier, and it's really great to be here with you all. I am Kate Hoy from the Interagency Council. Just wanted to provide a few updates, including, and actually, please stop me at any time if I apologize for missing the beginning of the meeting. If there's something that you covered in detail that I am covering again, Brian, and anyone, just let me know. How much time do I have?
We're good. We still have 45 minutes left for the meeting, so you're good.
Okay, great. I just want to let folks know, and Brian, I'm sure you've seen this and we'll send it out after the meeting. But while we've been on today, the DSS has issued an update that they were informed by the New York State Office of Temporary and Disability Assistance, or OTDA, that they do not have authorization to distribute November SNAP benefits. And as a result, clients will not see scheduled payments in their Access HRA accounts or on EBT Edge. The directive to states from the United States Department of Agriculture, I'll put it in the chat, and I'm sure, again, Brian will send that to everyone. Sorry for this long link. So October 2025 SNAP benefits will be issued on or before October 31st. However, no payments can be issued starting November 1st, even if they include prior month benefits. Benefits that have been issued but have not yet been spent will still be available to clients in November. However, November benefits will not be available until the federal government authorizes the release of these funds by New York State OTDA. At this time, cash benefits and supportive service payments will continue to be issued to eligible households without interruption. There's more information in that email. Please go to Access HRA if you have that app, and if you don't, please download it. I'll put some more links in the chat as well. But just to start off, I know we've been waiting for that update. It's a really important update. So I'm sure there will be more information to come. So just to jump in, and actually I was hoping that DOH could come back. There's a new early intervention portal, just to let folks know. It's just been rolled out so that members of the public can also make direct referrals for early intervention services. And this includes a lot of us who may be ancillary providers. Not physicians should still use the method that they've been using already to make referrals, but this is increasing access to early intervention, which is a really terrific thing. Just in general, we also learned there's an SSI increase of 2.8%. So that will be the COLA. Staff have been called back to CMS to work on the November enrollment for healthcare. And of course, again, sharing just the top line of deep concerns around SNAP or the Supplemental Nutritional Assistance Program. So federal updates, again, it's day 27 of the federal shutdown. Democrats and Republicans were unable to reach an agreement on spending by the start of the government's new fiscal year on October 1st, which triggered the shutdown. We've already passed the first pay period that went by without checks being issued to government workers. And we know, especially here in the New York area, it's not just Washington, D.C. We have a lot of federal workers here that are also feeling that pain, which will ripple through all of our communities. So while services continue, the ongoing failure to fund the government is going to have implications for people with disabilities and people who depend on a wide array of federal programs. And yeah, so, okay. I'm sure a lot of this has been covered. So the longer the shutdown lasts, of course, the bigger the impact. Social Security and supplemental security income benefits will be paid, but offices, again, with furloughed or laid off workers will not be as responsive. Programs like Medicaid, Medicare, and Social Security will continue to be funded because they are mandatory programs. But the vast majority of disability programs, including everything funded by the Administration for Community Living, are discretionary, and those will be impacted and have been impacted by the shutdown. CMS has sufficient funding for Medicaid to fund the first quarter of fiscal year 2026, which we're in, based on the advanced appropriation provided for in the full year Continuing Appropriations and Extensions Act of 2025, if you're taking notes. However, CMS is unlikely to approve state plan amendments and waivers. So with hundreds of thousands of workers across federal government furloughed, getting assistance is going to be difficult. And here in New York, we have even, for example, the EI 5% rate increase for EI providers, which is so desperately needed, is still with CMS, and we do not expect it to be processed. 53% of CMS staff have been retained. And again, some of those CMS staff have actually been called back, so it may be a little higher than that. Contingency plans at HHS are available. I'll put both the contingency plans for CMS and the Administration for Community Living in the chat if you're interested. The plans detail, as the shutdown continues, they actually detail how staff furloughs roll out. It changes the longer the shutdown continues. So those are there, and they will be updated. Just to remind folks that during the shutdown in 2018, which lasted until January 2019, effects were widespread. Disability providers were unable to hire new direct support workers because they couldn't access the E-Verify system. Rental assistance contracts for people with disabilities were not renewed, and furloughed parents of children with disabilities struggled to pay for therapy. So again, it's quite broad. Additionally, reductions in force, which are essentially layoffs. It's a notice of layoff with a 60-day delayed implementation date. Those began on October 10th. Subsequent memo floated by the Office of Management and Budget also raised the possibility of preventing furloughed workers from receiving back pay, which is likely illegal and is sure to be litigated. So there's widespread concern that the current situation has added significant pressure on agencies that are already stretched thin after the administration substantially cut back the federal workforce earlier this year. Big picture, federal funds are routinely carried over from one fiscal year to the next. Agencies account for a possible delay in funding, but at some point those carryover funds will run out. WIC, which provides, I think everyone's familiar with WIC, it's a nutritious food program for low-income parents and children. that will run short of funds, may be forced to discontinue services. There's a lot of conversation around funding WIC. People with IDD and their families rely on predictable funding to live, work, and thrive in their communities. So firing additional federal workers only increases the insecurity that people, families, and organizations are already facing. Just gonna jump in again and remind folks, I think when I joined, folks were talking about, Pilar perhaps was talking about talking to your legislators. We underscore that message. Let your legislators know the impact that programs and services have in your life. Let them know how important these are, especially if you are in a Republican district. If you have family that live outside of New York State, or if you're on Long Island, some areas of Westchester, talk to your legislators, talk to your family, and urge them to contact their legislators. Let them know, again, there are candidate issues and there are issues. So this is just an issue that we hope we need to raise broad support for. I think there's been a lot of information around the U.S. Department of Education. That reduction in force order from October 10th has severely cut staff there, massive impact to Office of Special Education and Rehabilitative Services, as well as the Office of Civil Rights. More than 400 people, closer to 500, received termination notices that their jobs would be eliminated in 30 to 60 days. That raises serious concerns about the viability of IDEA and the Office of Civil Rights, of the ability of the federal government to fulfill its mandate to oversee and administer these programs. There is not a way for some of these offices have one person left, right? They have the director and there's no one really else beyond that. Yes. So this is beyond existential. Similarly, I know how we're concerned as to how vocational rehabilitation agencies and schools across the country will be able to continue to provide services to people with disabilities without the funding and support that comes from OSERS and the Rehabilitative Services Administration. So we strongly recommend that if you care about IDEA, we know you do. We know you care about IDEA. We know you care about students with disabilities, programs and services that support them. Please talk to your senators, talk to your representatives, talk to your neighbors. It's not okay to cut disability-related programs. We are absolutely moving backwards by doing so. It is not the case, as the Secretary of Education says, that there has been, quote, no impact or no visible impact to special education, which is proof that we don't need these programs. The line is that states are functioning as normal. They will not. So without federal oversight, without the ability to fulfill the mandate, we absolutely will see an impact to students with disabilities and families. So yeah, I could go on there. I think there's been a lot of good conversation around that, I hope. So 95% of the education department staff are furloughed. Again, we're not monitoring compliance, civil rights complaints, collecting data, or answering inquiries. K-12 funding for the current school year is largely in place because those programs are forward funded. So Title I, Title II, IDEA advanced funding for the month of October went out, and there was a lot of concern around that. Impact aid, so military bases, tribal lands, those have not received their payments. FAFSA is open and operational, but a prolonged shutdown will affect customer service. Pell Grants and federal student loans continue, and really critically, to more than 40% of us who have student loans or our parents who have taken student loans on behalf of their children or grandchildren, payments remain due. Really important to let folks know with student loans, it can be very overwhelming. There are programs that are ending, and it's really critical that folks pay attention to their student loans now. There are organizations like Savvy, SABI, and Summer that can offer some support. New York City has partnered with Summer, and New York City residents can receive support through Summer, again, SUMMER, for student loan support. And anyway, we urge folks to take action now. Wage garnishment has started again on August 1st. So just want borrowers to be aware of their options. For the state, we are carefully watching, as everyone, the SNAP funding lapse. Just to put in New York State OTDA, and I apologize if they should be up to date, but the news update came out after I put this together. So New York City HRA and New York State OTDA links are there to get the most current information to let everyone know. So on November 1st, sorry, I'm getting all my dates. My dates are everywhere. November 1st, HRA will be required to implement SNAP eligibility requirements for able-bodied adults without dependents, or ABOD. And it will require certain SNAP recipients to comply with the ABOD requirements. So rather than going into it, unless Brian, you think we should, we'll have more conversation about this, but we really strongly encourage everyone to download that Access HRA app and to visit these sites so that you have information, that you need current information, and that you're able to speak to your community about what you need, and the information as it becomes more available. DSS and HRA are in a race right now to implement additional guidance about the implementation of these new requirements, and that these requirements were sped up. So we will see more in the coming days.
And Kate, I just shared out the email to the mailing list while you were talking.
Great. Advocacy asks for 2026 in the state budget. Brian, did you already go over those?
We did not talk about that.
Okay, so I will upload, and I'm sure Brian will send out the New York Disability Advocates, which is the Provider Associations Association, has met and put together their funding priorities for the 2026-2027 New York State budget. Those are, we're seeking a targeted inflationary increase of 2.7%, a care force affordability initiative to support housing, childcare, and healthcare for our DSPs. And each of these have additional aspects of each of them, which are included in the one pages, and we will get into further. And I know Brian and your advocacy committee will get into the weeds on this as we get closer to January. So, and 3 is infrastructure and care system investment, aligning with the CLCPA climate goals. So more to come on those, and I'll put that in the chat. The governor extended the executive order allowing pharmacists to administer the COVID vaccine to anyone who wants it without a script. Just personal disclosure, I was able to go into my Walgreens and I got mine earlier this month. Medicare telehealth flexibilities were sunsetted on September 30th because of the government shutdown. Those telehealth flexibilities have now expired. So we've reverted to pre-pandemic reimbursement policies that limit patient locations, eligible providers, and require in-person visits for certain mental health services. So patients should expect a shift from the expanded virtual care options to more restrictive rules. And healthcare providers should review the new arrangements, as other plans and Medicaid may also be affected. Just a reminder that behavioral health continues to be allowed via telehealth. The OPWD, I imagine that Nina probably covered parts of this, or Lucy. The site review protocol and person-centered review were updated on 10/1. Schools update to let everyone know, big news in EI, that there was a lawsuit filed last week by the law firm Bond and Scheck on behalf of the ACTS Coalition, which represents certain early intervention providers here in New York State. It's an Article 78 lawsuit. I'm not a lawyer. So I'm happy to have someone come back and tell us more about it in the future, Brian, if that's something we're interested in. But right now, just to let folks know, the EI system is truly in crisis. and we're losing providers because of low reimbursement rates. So this lawsuit alleges that the state has violated their own regulations requiring the Department of Health, the State Department of Health, to revisit reimbursement rates annually and to reimburse at market rates, essentially. So there's more there, a lot of legalese. And so we'll be watching that closely, and we'll come back with more. It's sure to take a while. The 4% SPA for early intervention was finally passed. It'll be retro to April 2025, 5%, as I said earlier. We don't expect any movement on that because of the government shutdown. I put information about a transition summit that's on November 8th, and I saw there's quite a lot of events for transition, for students who are transitioning from high school to adult programming. The Transition Summit is a partner summit organized with, what is SPA? State Plan Amendment. Sorry, Ellen. Thank you. Thank you. Thank you. Thank you. It sounds nicer than it is. Well, it is if we actually get the funding. So a SPA can be great. Yes. Thanks, Ellen. The Transition Summit on November 8th, it's a Saturday. It's from 10 to 2 at John Jay. Everyone is welcome. You can or you do not have to register. We encourage you to register. It's in partnership with the Transition Alliance and CUNY. And it's really geared especially toward students with developmental disabilities. You know, our 853 schools, our state approved special education schools are especially welcome. And you don't have to live in New York City, frankly. If you are on Long Island, please, you're more than welcome. Long Island, Westchester, et cetera. There's going to be a lot of organizations that have programs all over. Okay. There is a transportation strike looming. Service is we're hoping for an agreement, but there is a likely or possible interruption in school bus service. You may have heard that bus companies are threatening to stop service on November 1st, which is technically a Saturday, as part of an ongoing contract negotiations. It's not certain that anything will happen, but we just want families to be prepared for a potential interruption. And ARISE recommends, and these are the recommendations from the ARISE Coalition, signing up for a NYXA account, a New York City Schools account, if you don't already have one, since key information will be posted on NYXA. Visiting your child's NYXA account to confirm which bus company serves your route, as not all companies will be affected, and asking your school for the name and contact information of their transportation coordinator. And Advocates for Children asks, they're going to have information on their website, and there will also be information on the New York City Public Schools website so that folks can stay informed as the situation develops. So I'm just going to put, again, this is from, oh, it's too much information. Advocates for Children, so that folks can stay up to date. Apologies. Oh, it's still too much. All right, I will try to do that in a minute. Also, there is a parent, there's a hearing tomorrow evening. So this will be hosted by the recently formed Pupil Transportation Advisory Commission, or PTAC, made up of parents and advocates. It's holding a virtual hearing tomorrow at 6 p.m. to gather feedback from community members about school transportation. You can register to attend or speak at the hearing, and you can do that. Here, sorry. Their link is in the chat. Hot off the presses, our IAC lobby days in February are coming up. Our annual conference will be on June 10th and 11th, and education lobby days will be in May. It's time to vote. As I wrap up here, I saw someone already put this in the chat. Saturday was the last day to register, but for everyone who's registered, get out there and vote. Early voting is through November 2nd. Just make sure to check the times of your local polling site, because they change, and also your local polling site may be different from your early polling site. So you can actually see a live tracker. You can see estimates of the line. If you go to the sites that I just put, Vote NYC and Find My Poll site, and you can see what it looks like and when you want to go. Thank you. Any questions? Or I know that was a lot of information.
Thank you so much, Kate. That was a lot of information, but it's all useful and helpful information. And some of it is good because I forward a lot of emails and not everyone reads them, and you put it into words. So I think they'd rather hear it from you than read all my emails.
We love your
Rochelle has
emails,
a
Brian.
question.
Yeah, I have a question and then a comment. First of all, thank you. It's like I'm on information overload, but I think it's
Sorry.
really critical. No, don't apologize. It's really important. There's one small thing that's not so small, maybe, that hasn't been addressed anywhere that I've seen, which is that for people who have Medicare, which is, half of the OPW population, roughly, because of the shutdown, telehealth services, with the exception of behavioral health telehealth services, are not being covered by Medicare. And this, I'm concerned about how this will affect the telehealth. I'm concerned in general, of course, but particularly how this will affect the telehealth units and that whole system that's installed in many of our certified residences, including my son's. So that's a very particular question. I know you may not have the answer, but I did want to raise the concern about this. The second is a comment, which is that, writing to our Democratic legislators, it's okay, but they can't do anything right now unless you want them to end the shutdown, which I personally do not. I felt like the government is doing things it was going to do anyway. And, they wanted to dismantle the, special ed services and DOE. And they wanted to do many of these things. So they're just doing it somewhat sooner than they might have. But my question is this in particular about Nicole Maliotakis, and in particular about the cuts to IDEA. I know that our colleagues in Staten Island had tried to reach out to her for a while about HR 1, and she's now been avoiding them since it passed. But in the past, when she was a local representative, she was always a strong supporter of special education and people with disabilities. And I'm wondering if she might be someone, because she does represent part of Brooklyn as well, that we should pressure right now. But in particular, I don't think she'll back off about, the shutdown or all of that, but in particular, the impact on special ed services and IDEA in general. I was wondering if folks thought that might be a useful strategy.
I was kind of waiting for anyone else to jump in. Yeah, I mean, I think that they're under a lot of pressure. I'm not making excuses for anyone. It's inexcusable to the abdication of responsibility for students with disabilities. There's a lot of pressure on folks. Sure. I think it's good to talk about advocacy strategies. What types of communication may be beneficial. I know at Anchor, we're talking a lot about this and in other groups. Rochelle, I don't.
I'm particularly talking to IAC about this.
Oh, great. Then
Yeah.
let us continue. We will continue to talk about it. We absolutely, this is something that we talk a lot about. Some of our reps just are absolutely not taking any calls. So I can leave that there for a minute.
To do besides call.
There are things to do besides call. It's a really challenging moment right now, and let us continue to think about it. I'll talk to Winnie and see if we have some additional guidance. I know we will.
Okay, thanks, Kate. And also some feedback on this telehealth issue.
So telehealth, CMS announced a continuation of the claims hold for Medicare telehealth services impacted by the expired waivers. I included information about that in the chat. It is it as you said, and I will look into it to see if we can find anything more up to date. That's from October 17th and October 15th. Yeah, it's a unbelievably challenging time, but this is a critical issue. And let me see if I can get some more information, Rochelle, and I'll send it to you and to Brian.
Thank you.
Any other questions for Kate? All right, thank you so much, Kate.
Thank you. And I appreciate the questions. That part of our role here is to certainly hear the questions, and don't have answers immediately, obviously, for some of these, but I will take them back and we will certainly follow up.
Appreciate that. All right, so we have about 15 minutes left, so I will open it up for announcements. So please just pop your virtual hand up and, oh, I'm sorry, Debbie, yes, you have MTA and family support update, and then we'll get to announcements. My apologies.
Yes, I do. Okay, I also have to do the parent provider information committee. Okay, the last provider information committee was on Wednesday, October 15th. You're right, it was the third Wednesday, but it was the Jewish holidays. ACA made a great presentation. Our next meeting is going to be the second Wednesday, November 12th, from 10 to 12. We don't have a speaker, but if anybody wants to present, please get back to Rosal or me, Deborah Greif, and my email is at bfssac@yahoo.com. Now, we also have first and also the advisory council, instead of being on Ring Central, we went to 25 Beaver because of the Cass and Cans presentation. So we did learn a lot, but we are going to wait till they're going to put everything online, and whatever presentation was, you'll see it. The advisory council's next meeting will be on Tuesday, let me make sure I get the right date. The third Tuesday, and right before Thanksgiving, we're going to have the New York City Human Rights Commission is going to do a presentation for human rights so families can understand. And we have had them at our resource fair, and thanks to Carrie, the next one is going to be at Borough Park Library, November 7th from 11 to 1. You can also contact Carrie Banks. We also have an ADA transportation forum at the Brooklyn Heights Library. That's Thursday, November 20th from 5 to 7 p.m. We're going to have Access-Ride, New York Ferries, MTA Accessibility, DOT, and much more. Also, this Thursday, there's going to be the IBX presentation at Brooklyn College in the Student Union Building. And that'll be from, sorry about this. Will be from 6 to 7:30 p.m. Yep, I got it right. No, I'm sorry. It's 5:30 to 8 p.m. and it's going to be at Whitehead Hall, 2170 Campus Road. And they will be discussing about the IBX. Also, there will be approximately 15 more of the customer service centers that will be presented. And the next advisory council meeting will be on Tuesday, October 18th from 10 to 12. Also, everybody should know that they can apply if they live in New York City to be on one of the 59 community boards. So with that, I'm done. Hope I got everything in.
Thank you, Debbie.
You're welcome.
All right, so the first hand I see is Carrie.
Hi, me again. So I just wanted to point out, I put some events into the chat, including the one Debbie mentioned, the Accessible Transportation Fair. We're really excited about that. But for those of you who remember, who are like my age and up, Gary Schulman will be doing a virtual workshop for inclusive services on, November 5th, right? Or 7th? No. Yeah, no, 5. I was right the first time. From 5 to 6 p.m. It's on I Need a Break, and it's about respite services and other ways to get breaks for parents and caregivers of individuals with all types of disabilities. We're very excited about this because we all know Gary does a good job. But here's the thing about Gary, right? If somebody raises a question during his workshop and he can't answer it, he'll email them the answer at 3 a.m. or that morning or the next day. I mean, he is just methodical about responding to families and individuals. So keep an eye out for that. I put the link in the chat. And then I just wanted to say, because we've sort of been talking about this, that ADAPT has a webinar coming up on Thursday on medical transition for individuals aging out, right? So under the age of 22. Turning 22. I'll put the link in the chat. Again, this is not an inclusive services workshop. This is ADAPT Community Network, but it seemed on target, on topic today, so I thought I'd share it. And I've posted my contact information a couple times. We have a lot of really exciting things going on in the next couple of months. So if you want to be added to our mailing list, drop me an email and we'll add you on. Then you don't have to listen to me quite as carefully in these meetings at the end of a long meeting. So it's good to see everybody, and have a great week. Thank you.
Thanks, Carrie. Doris.
Hi, everyone. My name is Doris Kahn. I am the Outreach Coordinator for New York State Institute on Disability. We're a family support agency. And yes, Brian, I read all your emails, as I'm sure everyone else does too.
I appreciate you.
I want to thank the Department of Health for that comprehensive talk. The reason we didn't have questions was very comprehensive talk on flu and the other viruses that we can encounter. And now we have information to direct our families about it. I just wanted to say that NYSID we have openings now for evaluations for children and individuals who do not have Medicaid, who are seeking OPWD eligibility and reside in Queens, Brooklyn, Bronx, and Staten Island. And for more information, contact Elizabeth Sunshine at 917-699-0578, or you can email Liz at esunshine@nysidinc.org. We also, NYSID provides crisis management services for families that reside in Brooklyn, Bronx, and Queens, and who do not have a self-direction. They can contact Juliet Hawkins at 917-524-4856. NYSID also provides reimbursement for goods and services for all 5 boroughs, and you can contact Jackie Tripodi at 929-202-1115. NYSID has tickets for outings, and now the holiday season is coming up soon, and we have tickets for individuals and family members, and if they live in Bronx, Brooklyn, Queens, and Staten Island. We do not provide tickets for individuals that have self-direction services. You can contact Sarah Alton at 718-494-6457 or email her salton@nysidinc.org for more information.
Well, I guess we could. Well, so you just mentioned all these different resources, so maybe we could check internally first and see if there's a volunteer, and if not,
Nigel, are you talking to us?
Hi, Nigel. I don't think he was talking to us.
All right, I just muted him. I thought he was trying to ask you a question.
Right. NYSID also provides free transportation services for individuals who live in Brooklyn, Bronx, and Staten Island. And for medical appointments or recreation, and contact John O'Grady at 917-747-9424. I put all this information in the chat. Thank you.
Thank you, Doris. Next up, I see Chelsea.
Good morning, how are you?
Good morning.
My name is Chelsea. I'm here with my colleague Maria, and we are community liaisons with public partnerships, also known as PPL. We're here to share an important update for people in CityPAP, also known as Consumer Directed Personal Assistance Program. We got 2 deadlines approaching for personal assistance. The first is the PA health assessment, which is an annual physical which PAs must complete as soon as possible in order to be compliant with services and to continue providing care. And the second is a mandatory training, which is due to be completed December 31st. We're going to drop the details for that in the chat if you want more information as well.
If you could also email me that way I can share it out to the mailing list. That would be
Yes.
helpful too.
Of course.
Thank you.
Thank you.
All right. Any other announcements, questions? I don't see any other hands, so just so everyone knows, our next meeting for the General Council is Monday, December 24th at 10 via Zoom. And I believe as of right now, we are supposed to have a presentation from the New York State Office of New Americans on the Ramirez June Initiative. So
Sorry to
we've scheduled
interrupt.
that a few
Is
times.
it
It's been pushed,
November
so
or
hopefully we
December,
get them.
Brian? Sorry to interrupt. It sounded like no. Is it December or November?
The next meeting, did I say December? I meant November
Yes.
24th.
That's
Oh,
what I'm
sorry.
asking. Sorry.
November 24th. We're not
That's the
quite
only
in
reason I
December
would
yet.
interrupt. I apologize.
No, that's
Lynn.
completely fine.
Mhm.
November 24th. And if you go to our website, bkddcouncil.org, you will see it under the calendar page, all the links to any of our general meetings, all of our committee meetings, and anything like that. And I think that is all I have. So you all get a whole 5 minutes back in your day. Thank you, everyone.
Thank you. I could use
Thank
those 5
you.
minutes.
Thank you. Have a good day,
Thank
everyone.
you. Bye.
Bye.
Bye,
Bye.
everybody.
Bye.